This health care tax credit is a vital tool for struggling Americans to pay for their health insurance. The amendment would extend the tax credit for 2 years. As, again, many of you know, this tax credit helps Americans who experience job loss and receive TAA, trade adjustment assistance, or have had their defined benefit pension plans taken over by the PBGC, the Pension Benefit Guaranty Corporation. Often the health coverage tax credit serves as an important bridge for Americans until they become eligible for Medicare benefits. This amendment extends this tax credit at the current level that covers 72.5% of health insurance premiums, which was reached after some intense bipartisan negotiations in 2011. It expires on January 1st, 2014. For a lot of users of this program, including about 20,000 families of the Delphi salaried retirees who nearly lost everything during the GM bankruptcy, they very much depend on this health care tax credit for their health insurance. In this case, those pensions were turned over to the PBGC. However, for a lot of these folks, like the Delphi retirees, they do not fit well into the Obamacare premiums. In other words, even with the subsidies under Obamacare, their premiums are going to be higher than what they're paying under their group plan. And they've got very little margin in their family budgets based on what happened during the takeover and during the auto bailout where they were left behind, and they had their pensions terminated. So GAO has looked at this. They've determined that 69% of the people who currently receive the health care tax credit would be worse off under Obamacare. So they would agree with us on that. Certainly that's the anecdotal information that we have from particularly these Delphi retirees. There's bipartisan support for the health coverage tax credit, always has been, and I believe this belongs as part of the package we have before us today, which also deals with the health care issues. I think extending this coverage is fair to these workers, and I hope, Mr. Chairman, that we can have it added to this package today.
Are you offering withdrawing?
Well, I would like to have it offered as part of this package today that's moving forward.
I don't know.
Chairman,
I don't know that we can do that. I'd encourage the senator to offer and withdraw so we can keep working on it.
Mr. Chairman,
this is not. It's not germane to the subject before us, and I would.
Mr. Chairman, could I speak for it before withdrawal?
Valor, if we can figure out some way to work this out without forcing the issue. Senator Brown.
Yeah, thank you, Mr. Chairman. I want to offer support, and if Senator Portman's withdraw, I want to continue to work with him and with this committee on that. But we know that TAA and the trade adjustment and HC, the health care tax credit, are no substitute for a job, yet it's essential for many displaced workers. We know what happens with no matter your position on trade, we know there are some number of winners and some number of losers. Quantify them how you will, but those who are losers to trade policy need something like, or other kinds of upheaval in their economic lives need something like HCTC. It's important that we extend these benefits for workers, retirees who lose their jobs and benefits primarily through no fault of their own, and extending the tax credit makes sense, extending to provide health care for a number of workers. So I offer my support for the amendment that Senator Portman and I and others are offering.
Mr. Chairman?
Mr. Chairman. Mr. Chairman, I just simply wanted to ask unanimous consent to be added to Senator Portman's amendment. I've also joined with Senator Brown. I commend both of them and just indicate this is very, very important for displaced workers and retirees. And in the middle of what was a positive outcome in terms of the automobile industry, people who were left behind with the Delphi retirees, which should not have happened. And this is incredibly important for them as well as others. So I commend colleagues, and I want very much to continue to work with you.
I appreciate, Mr. Chairman, I agree with Senator Stabenow. I wonder, Mr. Chairman, in that it's not germane today, would we be able to get a commitment that this could be included in whatever short-term patch goes into effect on January 1st, and that this health care coverage does end on January 1st? And normally, perhaps it would be dealt with as part of TAA or some other trade discussion, that is likely to be put off, as I understand, until at least the spring, and there would be a gap here. So if we could get a commitment today, since this is a bipartisan issue where there's a lot of agreement, to have it included in whatever patch is put forward January 1st on, we would appreciate that commitment today.
Senator, I think it's a bit much. I don't think we can put it in the patch. The patch is just would be just an extension of a current SGR policy, and if it's not germane to this, it's not germane to that. I very much appreciate the concern, but I think the appropriate process here, frankly, is for us to sit down and work out some way to accommodate your wishes, your intention. But I can't make a commitment now that this is going to be part of a patch. I can certainly commit to working with it. I mean that. That's not an idle statement. But it's not germane. All their amendments have been germane, and one could make the same argument for other non-germane amendments that senators may want to bring up that are brought up not here, but in the context of a patch. And I just don't know that it's appropriate to do that at this point.
Well, I appreciate your consideration, your willingness to work with us. This is unusual, as you know, because it does end January 1st, and these families are going to find themselves with a real gap in their coverage. I suppose, Mr. Chairman, as a backup, I would ask that you work with us on the TAA extension, which, as you know, is likely to come up later in the spring.
TAA is a necessary component of any potential TPA, and I don't say potential. We're going to pass TPA. Therefore, we're going to pass TAA. And when we pass TAA, this is probably a very important component.
We would appreciate you working with us on that.
The tax credit. Thank you, and I thank the Senator for withdrawing.